Money Control presents Transforming a Billion Lives, presented by AWS Intel.
Hello and a very warm welcome to Money Control, Transforming a Billion Lives, presented by AWS and Intel. Through a series of conversations today, we hope to look into some of the innovations that have disrupted the healthcare space since the pandemic. What more do we need to do to ensure that technology is greatly integrated into making healthcare more accessible and affordable? We have with us for this Mr. Sunil PP, South Asia Lead, Education Space NPO and Channel at AWS. We have Mr. Mudit Danwate, CEO and co-founder of Dozy, Mr. Nrip Nehlani, Director, Product Management and International Marketing, Plus 91 Technologies Private Limited. Thank you very much for joining us and taking up the time. Sunil, speaking from a cloud perspective, how can cloud-driven healthcare solutions provide actionable insights to accelerate time-to-time impact for patients? And what are some of the areas that AWS partner solutions in this area?
We've been working with the healthcare IT ecosystem, healthcare ISVs for a very long time, right? And we've seen them leverage AWS primarily because we've proven to be the most reliable provider in the market right now. And we've had fewest number of downtimes ever is primarily where we are. So one of the areas that we're seeing many of the ISVs and solution providers adapt is primarily around machine learning, right? There are a lot of providers that are leveraging Amazon's SageMaker, for example, for ML modeling. And we're seeing that consumption moving up in a big way in the area of healthcare. The Comprehend medical solution that is there, that primarily allows for database management, is something that we can look at a large portion of customers and partners leveraging that as they scale. So one of the areas that in India that we are seeing is around local language learning, right? Local language access. And we're seeing a whole bunch of work happening around transcribe, whether it's healthcare, whether it's education. Amazon Transcribe Medical, which is a service built for the medical fraternity, is something we can look at around speech to text capabilities and looking at scaling there. So we're seeing a lot of these little interesting changes happening in the provider system, which is leveraging the vast array of services that AWS has globally. And actually looking at the referenceability that we have right now, whether across healthcare globally or locally, which is kind of becoming a reference point for most customers and partners to look at. So partners are seeing and using a variety of new services that we've launched over the years to try and make their applications even more powerful and to address the last mile patient requirements in a much faster manner.
With it, Dozy is a partner in remote patient monitoring with an emphasis on continuous and contactless vitals monitoring. Take us through the solution and how it's enabling efficiency and accessibility in the healthcare space.
We use ballistocardiography sensors, right, which we have indigenously developed. These convert raw vibration data coming out of your every heartbeat, respiration cycles, body movements into digital signals, and then using AI machine learning, we convert this into different biomarkers like heart rate, respiration, and in fact even world's first contactless blood pressure, apnea, and many other biomarkers as well, right? So that is the second part of it, which is conversion of the signals into meaningful biomarkers. And the third very important part, where cloud also plays a very important role, is into providing all of this information in a consumable way remotely, right, for the clinicians and for the nursing staff who might not be present next to the bedside. But if the patient is undergoing an abnormal vital, it generates a alert and thereby facilitates early intervention over there, right, thereby saving lives. In fact, using this alone, right, in last 1 year itself, we have saved close to about 8,000 lives by giving these AI based alerts. These have been documented as well. And because this also automates the entire nursing workflow, it was manually done by nurses going near the patient, noting down the vitals, noting it down on a piece of paper and so on. We have saved close to about 2.5 million nursing hours as well in just last 1 year alone, right? So that is the amount of impact that a small change like this has been able to do.
Nirab, how can digital health IDs and EHRs make a positive impact in India's healthcare ecosystem? Also, tell us how solutions like the MediExcel medical platform are enabling this transformation.
Digital health IDs are a very big necessity to ensure that you can create a unique patient identifier. Whether a person goes to a primary healthcare center or a public hospital or a private hospital, or even gets care, inside a foreign country, the digital health identifier is able to, ensure that this is identified at the healthcare level as a single patient. The health ID combined with the electronic health record allows us to have a single dossier of sorts of the patient's health conditions. Now, why this is very, very important is because this helps in the creation of coordination of care. How MediExcel medical platform and is enabling this transformation is because today we are already looking into the data for about 45 million patients across the world. We're already looking at this particular data and trying to make sure that the patients have unique records. With those unique records over the last, I would say, 10 years that MediExcel's been around, we've seen that the impact has been that hospitalization rates have decreased. We've seen that rehospitalization rates have decreased further. What we have seen is that screening has benefited patients from actually not being hospitalized and actually having home rehabilitation take care of them. Another thing that we have seen MediExcel being able to do is that help in public health significantly. Looking at the data from the platform of this 45 million patients, we've been able to identify a large number of markers, whether they are screening markers at a personal level or they are screening markers at a public health level, to identify the emergence of new symptoms or new diseases which can actually become an epidemic of sorts in a local population. This is predictive modeling based. It is using predictive analytics. It is using AI. It's using all these good things which AWS we have been able to use. We are big users of Transcribe. We're very, very big users of the AI models inside AWS. And MediExcel is able to actually make sense out of the EHRs of patients. And if they are linked with the digital health IDs, then the patient remains the same wherever they go within the country.
Money Control presents Transforming a Billion Lives, presented by AWS Intel. Money Control presents Transforming a Billion Lives, presented by AWS Intel.
This roundtable on healthcare to the last mile, realizing digital in healthcare is a step in that direction. Joining me on the panel is Shalini Kapoor, Director and Chief Technologist, WWPS India from AWS, Mr. Sohit Kapoor, co-founder of Briefcase, Mr. Kaustav Nayak, co-founder and Director, Periwinkle Technologies, and Ms. Veena Muktali, Chief Executive Officer, Periwinkle Technologies. Thank you so much for joining us. Kaustav, from a technology provider perspective, how do you understand and evaluate the evolution of digital healthcare in India?
Digital healthcare has seen a significant evolution in India in the recent years. Several factors have contributed to this growth, including increased internet penetration, evolution of AI/ML technologies, the government's push towards digitization in healthcare, and the rising demand for affordable and accessible healthcare services. To evaluate this evolution, we'll have to consider various aspects: adoption of technologies, the impact on healthcare outcomes, and the challenges and opportunities presented by the market. The adoption of digital health technologies such as telemedicine, EHR, AI-enabled solutions such as SmartScope has been on the rise. This trend will continue as more people, including healthcare providers, become comfortable with using technology. We all know that COVID also helped in this. Digital healthcare has a huge potential to improve outcomes by increasing accessibility and scalability, thereby saving time and money. Digital healthcare in India presents several challenges, including the limited digital infrastructure in rural areas, the need for the government to make policy changes to adopt new technologies, etc. However, these challenges also present opportunities for the technology providers to develop innovative solutions that addresses this issue.
Shalini, how is AWS driving digital transformation in healthcare? And can you please tell us about AWS Powered Solutions, which helped in reshaping healthcare tech in India?
We all have used COVID application during the pandemic, which was there last couple of years. The COVID architecture and the COVID's vaccination platform scaling was developed in record time on AWS platform. It brought the scalability, the modularity, the interoperability into this platform. This kind of a platform needed scale. It needed to go beyond and open up its API, become first of its kind, open source the code for global adoption, and help billions across the globe. And we have built a service called Health Lake, which is essentially securely stores, and you can medical data, it can transform, you can query and analyze all the health data in minutes. It uses interoperable standards such as the Fast Healthcare Interoperability Resources, which is also called FHIR. You can run medical imaging applications in the cloud to increase scale and reduce your costs. So, what it helps from a security of a patient's data that can be maintained, as well as a lot of ontology can be defined, and then you can do analysis, whether it could be on ophthalmology, on life sciences, on genetics, on any of the diseases that you want to map. You can get, and medical data is unstructured in nature, right? So you need a scalable as well as an application which can understand natural language processing, because maybe the health record that you are getting is in form of a prescription written by a doctor, not in a very good writing. So how do you read the prescription? How do you interpret it? How do you chat with the patient? So there are multiple AI technologies which come together on lab reports, on medical records, on insurance claims, and as well as doctor's notes. And based on this search and query, these AI models can give you the right visibility of what the disease is and make the right predictions. So these are some of the applications and solutions which we have made, and they have helped a lot of startups, a lot of customers build their own solution on top of this. And this helps them in reaching the patients and connecting the entire doctor health lab network altogether.
Meena, Periwinkle has revolutionized cervical cancer screening with a remote monitoring through your SmartScope solution. Take us through SmartScope and how it's enabling efficient and faster healthcare delivery, especially for women.
Worldwide, around 3 lakh women die every year because their cervical cancer was not detected in time. In India itself, every 8 minutes we see a woman dying because of this disease. So when the experts analyzed this situation, it was seen that majorly the loss to follow up by women was the major issue which was causing the mortality. So with that in mind, we have developed the SmartScope, which is a very nurse-friendly device, which does not require any infrastructure or any special setup, so that it can be used in any health and wellness center or any district hospital or any OPD or camp for that matter by healthcare personnel who are trained minimally. So what that means is this test can be now available at any local OPD for a woman as a preventive checkup. So instead of waiting for the symptoms to show up, a woman can get herself tested regularly, even during routine health examinations. Also, that means that the experts who are currently involved in extensive capacity building programs or in screening and triaging programs can also perform the same activities sitting at a higher center without having to travel to each and every site. That means more experts time is available for training medical staff. More patients will be able to take counseling from these experts, and that means we'll be able to scale up the screening programs to a much greater extent than we are able to currently.
So, what are your thoughts on digital health lockers and PHR apps, and do you see it as a necessary step towards universal health coverage?
If you were to draw a parallel of UPI in the ABDM world, I spoke about what steps need to be taken to be Aadhaar ready. The core remains that how does a patient play in the Aadhaar ecosystem, in the Aadhaar landscape, and that is where the PHR apps and the digital health lockers become a necessity. They become a utility product. So starting from creating your Aadhaar to linking your providers to, most importantly, providing consent for movement of health information. If you want your health information to move from that lab to the doctor, you need to be able to consent it. And the PHR app is the mechanism to be, or is the front end for you to consent to that movement of health information. So if you want to be a participant in Aadhaar, you need to have the PHR app or the digital health locker. And when you talk about universal health coverage, we are strong believers that universal health coverage requires a strong Ayushman Bharat digital mission. PHR apps will play a critical role. Yes, it'll over time also the role of PHR apps will keep evolving from what it is today. But as far as the patient is concerned, this would be a must-have for them to have. And as far as the government is concerned, if universal health coverage is an important goal, which we believe it is, then the whole ABDM framework and the PHR framework to that extent needs to be very robust and successful.
Money Control presents Transforming a Billion Lives, presented by AWS Intel. Money Control presents Transforming a Billion Lives, presented by AWS Intel.
Transformation of a billion lives. We're talking about AI, cloud computing, and several tech-led innovations in the healthcare space and how it can increase accessibility. And joining me on this panel is Mr. Samarth Mason, BD Leader Healthcare AWS, Ms. Akanksha Bilani, Global GTM Alliance AWS at Intel, Dr. Anil Muniappa, Head Healthcare Transformation Cloud 4C, and Dr. Surendran Venkatraman, Assistant Professor, Community Medicine Nodal Officer in Charge at eHospital IGMCRI. Let me begin with Samarth here. What is AWS's view on adoption of the cloud in India's healthcare sector?
A lot of these innovations are happening through our partners in the network who are leveraging a lot of our native capabilities, our services to build these solutions. Some of the use cases leveraging Amazon's or AWS data lake capabilities to build health analytics or data analytics. Leveraging some of our native services like Comprehend to build speech to text for doctors so that patient health records can be generated at speed. Genomic sequencing for virus analysis. A lot of the startups are building on AWS to solve problems in maternal mortality and child healthcare, tuberculosis elimination, non-communicable disease elimination. And then, of course, what we're doing with CHIB, that's running HMIS applications on cloud, on AWS for the country at large. We are at a stage in the country right now where, this is almost becoming like a norm. If you look at the three biggest national healthcare platforms, Covin, Arogya Setu, eSanjeevani, they're all on cloud. NHA's national platforms, ABDM, PMJ, both on cloud. If you look at Arogyashri in Telangana, that runs on cloud. If you look at what Bihar did recently, they've onboarded a completely born in the cloud HMIS solution for all their public sector hospitals. Total addressable spend on healthcare cloud in India was estimated at around $1.1 billion by a PwC report, which I was going through recently. So the opportunity is huge, but as the ecosystem partners, our focus is always to try and solve problems at scale. And that's what AWS is also all about.
Akanksha, to bring you in here, let me get some Intel perspective on this. What tangible impact did the adoption of technology have on public sector healthcare and its facilities? And also, if you could share some case studies showing Intel's technological impact in healthcare.
From an Intel perspective, we'd like to probably kick off by saying that our mission is to build cutting-edge technology that's impacting the lives of every citizen on Earth. And India obviously is no exception. There is incredible amount of data. There's incredible amount of requirement to try and see how technology can drive impact, especially in the world of healthcare. From a case study perspective, I think outside of Covin, Arogya Setu, and basically digital platforms that are helping healthcare get more stable. If you look at cloud today in terms of components of cloud that make sense for a healthcare organization or a government body, it's really the databases that could be hosted on AWS or on cloud. It's about the applied technology, whether it's a hybrid experience depending on the deployment model or the actual distribution model. It all really kind of comes together, whether it's memory, whether it's storage, whether it's I/O that is required, as well as probably even data security. All of these kind of come together and continue to be a very important need for the healthcare industry. Even right now, EMR is becoming a larger play in the healthcare providing space. So trying to ensure that all of these kind of comes full circle in terms of needs from a healthcare implementation perspective, and using cloud to make that happen is very important. And ecosystems of partners like Cloud4C that actually build those solutions as well as those use cases for the requirement of the specific health organization. So kind of putting all of that together is more a direction that Intel is taking to nurture, develop, as well as co-engineer with our partners, with our tech providers, with our cloud, and ensure that our customers, as well as those use cases that are so life critical, get the right benefit.
Dr. Anil, digital health IDs are set to become a game changer for the sector, with the leading healthcare centers like AIMS set to go paperless from 2023. A critical aspect or consideration in this has always been data privacy. We've seen something that just happened a few weeks ago, where data from AIMS was hacked into. So, what steps have you taken to prioritize keeping healthcare data more secure?
The success of actual digital health IDs lies with automating the smaller hospitals. Let me give you some statistics, right? In India, out of some 11.5 lakh private beds, only some 50,000 beds are actually collectively managed by top 5 to 6 corporate chains. So the real need is in handling the rest of 10.5 lakh private beds, and that's where we really want to be the game changers. These smaller hospitals in the range of say 10 to 100 beds have their own limitations, are the one who really needs to be assisted, and they are very, very critical for success of ABA or personal health record, which Government of India is rolling out, right? The healthcare industry in India has faced more than 1.9 million cyber attacks this year till November 28th. 74% of all healthcare data breaches are from hacking, and IT incidents are attributed to understaffed healthcare IT departments, right? Legacy technologies that are not configured properly for new medical technologies, and a lack of interoperability standards. So what we from CHIB, while we are offering a cloud-based solution, actually solves most of these problems, right? We have built the products which are completely on HL7 and FHIR standards, right? And the entire solution is actually inbuilt firewall. We auto-isolate and validate every backup. There's a two-factor authentication. Security as a service has been provided. Endpoint protection is also very key. And we provide entire migration, configuration, security, and ongoing maintenance of your entire cloud. So in short, your data is completely safe with us, and we are responsible to take care of this entirety in CHIB.
Dr. Venkataraman, as an early adopter, tell us about the thought process behind your decision to leverage CHIB, and what impact has it made on your organization?
Keeping in mind we have a lacking infrastructure in place, CHIB has given us a complete solution in terms of providing one, the implementation of HMIS with recent adaptations such as your ABDM, digital mission, where a patient can come and have a longitudinal electronic medical record so that he can access his medical records everywhere. So that is the ultimate patient-centered system that the patient can see anywhere when he moves throughout the country. I think among all the information which the individual is giving to a particular firm, health information is the most sensitive information which has to be protected, and it should be available to the user end only, that is to the patient and not anyone else. So CHIB has given us a full insight and a full data package to install it. Third, in terms of IT infrastructure, almost all the government initiatives, let it be ABDM or any other HMIs, even now our National Medical Council, okay, which is the governing body of medical colleges, emphasizes on cloud-based system so that there is a transparent data which is being shared from the user end, that is the medical colleges, to the national level data analytic members, so there is no duplication of entries. So data cloud companies like CHIB give us a complete solution of transferring the data anywhere. So I can sit anywhere else and look at the data, how IGMC RI is performing in terms of OPD and IPD.
Well, with that, it's a wrap from all of us here. One of the key takeaways from this entire series of conversations is that healthcare and technology, integrating the two, will have to require a multi-stakeholder effort. It cannot be just driven by the private sector or by the government alone. What's heartening to hear and to learn is the number of startups that have emerged in this space and that have disrupted the healthcare space, making it only better for people like you and me. We'll be back with more. Thanks so much for watching.
Money Control presents Transforming a Billion Lives, presented by AWS Intel.